Hello? Wait, am I heard? Is my mic working? Mic test, mic test. Hello, hello? Mic test. Hello? Hello, everybody. Good evening. Good evening, everybody. Welcome to my medical education stream. Yes. Alright. As suggested the last time I did my Shiori at work medical education stream, you guys wanted me to have a PowerPoint plus do the ShareCare YOU thing, right? Unfortunately, I still don't have the pro version of ShareCare YOU, which will make things a lot easier, so I don't have to keep switching around. Yes. The pic is so lewd. This is done. This artwork is by Nezbox, my artist mama, or well, papa. My artist and my rigger are both dudes, so Nez, but technically, well, I mean, like, the artist would be my mama, so Nezbox is my mama. And he also made this very nice, sexy art of me eating a hot dog. Yes, this is my booby stream. I have done this, I have done a medical education stream on breasts before, like a formal one, but it was done on Facebook, and that was like 3 years ago. Yeah, 2020. 2020, when I was still in my in that group, streamer group I was in Facebook. Yeah. So I decided, I checked, like I went through my medical education streams here on YouTube, and I saw that I didn't have a formal breast one, like a real like one stream dedicated for breast. So here it is. We're gonna do it today. We're gonna do the PowerPoint first, and then we'll do the ShareCare YOU, where I will demonstrate. ShareCare YOU is like what we did with colon, where we can have a close-up view on the boobies. Have you guys ever seen booba up close and personal? I will show you boobies up close and personal on this stream later. Okay. Also, yeah, you know what? I'm not much of a YouTube streamer, so the chat. So I think my stream is delayed to you guys in chat. I think there's like a 10 to 20 second delay. Something like that. So your chat comes up late. Okay, anyway, hello and good evening. Now, I forgot to set up my tablet. I don't think I won't use my tablet anymore. Okay. The attention span of the viewers will increase exponentially. Yeah, it always did. You know, the first time I did this stream in Facebook, there were a lot. I think that was my medical education stream that had the most viewers during that time. Okay, during that time. Okay. Alright. So, this is the same PowerPoint as the first time, but I changed it a little. And like I said, in YouTube, I don't need any more sensors. I removed all the sensors that I used to have before. I removed them because I don't need them anymore. In Facebook, I have to censor the nips. In Twitch, I also have to censor, so this is one thing in YouTube that I don't need to censor this, because if it's for education purposes, you don't need to censor. Yeah. Alright guys, we're gonna start. So, breasts or boobies, okay? Boobies. Next. Anatomy of the breast. Okay? I'm pretty sure you guys know where the breasts are located, right? I don't think, is there anybody here who does not know where the boobies in the human body, where the boobies are located. If you do not know where the boobs are located, I feel bad for you. I mean, even if you haven't touched a woman before or seen a woman before, men have boobs, so you should know where the boobs are located. Yes. Okay. Oh. Okay, there we go. Boobs. Okay. Also, the breasts are located on the chest. Okay. Breasts are located on the chest. So this is the anatomy of the female breast, but it pretty much applies to the male breast. Okay. So here on the left is a photo of the breasts. External anatomy. So you have the nipple, which you guys know what the nipple is, and surrounding it is the areola. Okay. And then breast also, when you include breast anatomy, it also includes the axilla. Axilla is the armpits, or basically yung kilikili. Kilikili, okay, that's axilla. We call this medically, it's called the axilla. And that's where a lot of the lymph nodes for breasts are located. Okay? Yeah. That's lymph nodes. Now, if we slice this chest here vertically and then do a cross section here, you will see that the nipple contains ducts. Okay, ducts connecting to the lobes of the breast, which consists of smaller lobules. Okay. And if I remember correctly, I think the breast has like 15 to 20 lobes per breast. Okay. And also, yes, the breast is surrounded by the lobes is surrounded by fatty tissue, and that's what makes the boobies very soft and squishy. Okay, it's the fat tissue. And then it is attached to the chest wall here. This is your pectoralis major muscle. Okay, and then the pectoralis minor is over here, and then you got your ribs. Okay. So lobes are the milk generator. Yeah, the lobes are the ones that produce the milk. Okay. One thing to note, males do not have these. Okay, the lobes. Okay. Males do not have this, only the females. What kind of fat's cholesterol? Fat, adipose tissue. We call this adipose tissue. Okay, medically. Not cholesterol. It's called adipose tissue. Alright? So, here is the external, where the breasts are located. Look at these breasts. This is very, very manly breasts. So this is located on the chest, okay? And these right here are the breasts, okay? Okay. If you are a man, you do not have the lobes. You do not produce milk, so you do not have the lobes. You have the ducts, but you don't have lobes, okay? So here, perfect boobies. Alright, next. Here we go, men. Man boobs. Alright, here is the man boobs. So it's almost the same. Look, see, you got the nipple, you got the areola, and you have the lymph nodes up in the axilla, your hairy axilla over here. Okay, now it's basically the same, but you don't have the lobes. See, no lobes, just fat. Okay. You have the ducts, they just connect to nowhere. Because you don't have lobes. You have the ducts in your nipple, but they connect to nowhere. They just exist. So fatty tissue or adipose tissue, and then pectoralis major muscle, pectoralis minor muscle, and then your ribs. Okay? Man boobs. Man breasts. Okay. Next. Now, So, a lot of people like to ask, before I was asked, is there a difference between small and big boobs? Okay, small and big boobs. Especially for women, what's the difference? A lot of people will ask me that. So, 3 years ago, the pictures here were different, but right now I decided to update the photos to more, recent popular PH VTubers. Okay? So, is there a difference between small and big? Actually, there isn't. Just the size. There is no difference. I mean, all breasts, whether big or small, have the same anatomy. It's just the what makes it big or small is the fat content. Okay, so we have some flat ones here. We got some semi-flat. We have a flat one here and a almost flat here. A little, and this one is a little bigger than this one, okay? And then we have big boobies, and then we have this one also. This anonymous boobs. Okay. Okay, I'm gonna look at the chat now. I'm sorry the stream is delayed for you guys, okay? Even the chat is delayed for me. Alright, let's see. Who is the sexy dude at the bottom right? I don't know, it's a random male VTuber that believes that he has a nice body. We don't need to know who this one is, okay? We don't need to know who that is. Can Petan still produce milk? Yes! Females, because the females have the lobes, okay? You can stay, even if they are flat, it just means that they don't have enough fat in their boobs. But if they still have the lobes, they can still produce milk, okay? Is it some sort of biological need to have bigger to survive? No, like I said, there is no difference. Because the anatomy of a big and a small breast is the same and the physiology is the same. So, it is up to preference of the person admiring these boobies to what they prefer, to what they like. If they like big boobies, like this one, this nice pair over here, then yeah, they can, then that's good for them, If they want flat boobies, then sure, good for them too. If they want, semi-flat boobies, or if they want manly boobs, it's up to them. Except that manly boobs do not have lobes, so they do not produce milk, okay? Is there a difference in the number of lobes for different women? No, it's the same. Around 15 to 20. It's the same. It's just the only difference between a small and small and big boobs is the fat or the adipose tissue. Okay. Question: if someone was flat and since boobs are fat, if they get fat and lose weight, would they keep the breasts or not? That is a good question. That is a good question. When you gain weight, you gain fat in your body. You get fat, right? That includes the breasts. So naturally, if you gain weight, your breasts will get bigger in relation to your weight gain. In the same way, if you lose weight, you will lose your breasts get slightly smaller as well. But the difference is if you gained a lot of weight and your breasts get bigger, and then after a while you lose a lot of weight after gaining, your breasts will get smaller and they tend to sag more because what happens is just the skin stretches. The skin stretches to adapt to the increase in fat content. And if you lose weight, you lose some of the fat, so it sags. It tends to sag. Okay? Alright. Next. We're done looking at these boobs. What is the purpose of the breast? I think you all know the purpose of the breast, right? You all know the purpose of the breast. So, purpose of the breast is to produce milk for babies. Okay? The breast will produce milk or start to produce milk when a woman is pregnant. Okay? And then starts to expel her milk through her ducts when the baby is feeding. Okay? And there is also another purpose for the breast, which is not much of a main purpose, but yeah, for pleasure. Okay? The breast is an erogenous zone. Whether you are a man or a woman, it is an erogenous zone. So this is the other purpose of the breast that you all know and like, aside from breast milk. I just want you to look at this photo, okay? I decided to pick this picture before. I don't even watch this. I don't read this. I don't even know what this is. I just Googled it and slapped it on here to represent breasts as erogenous zones, especially the nipple areolar area. Okay? Erogenous. I think y'all know. You think, oh my god, wait. Why is... I just realized I left a small... I left a tiny Sir Wheatbread over here. I forgot to remove Sir Wheatbread's old model here. This is Sir Wheatbread's old model. He was supposed to be censoring the nipple. I forgot to remove it. I'm sorry. Okay. What's this? Do they get bigger if massaged regularly? Actually, there are no therapeutic claims about that. Some people claim that they get bigger, but not really. Alright. Oh wait, what's this? Doc, according to my sis, when she get her measurements when making costumes, there are girls with big bust lines, but it does not mean they all have big boobs. They instead have a wide back. Yes! Because the boob size is related, if you know cup sizes, it's the cup size that determines the actual breast size. Okay? For example, I am a 34D. Okay? So, my bust would be a little over 34 inches, and my boobs are a D cup. Actually, no, I'm not D, I'm a double D. I'm a double D. If in US size. If it was Japanese size, I think I'm an F. I don't know. I think it's F. I think double D is F in Japanese size. Something like that. It's the cup size that determines the breast size, okay? The bust is different. The bust is like the whole back, including the breast. Something like that. Okay? Alright. Yes! 34! Double D. American. But I think in Japan that would be an F. Okay. Next! Self-breast examination. Okay. Do we have any girls here on the chat? Actually, even if you're not a girl, even if you're not a female, I think some males, although males don't need to really do this because it is rare to have a tumor on your breast, but some men can still have a tumor. Okay? Okay. If there are ladies out there, this is how you examine your breast. If you are an adult of reproductive age or have hit puberty, it is advisable that you do a self-breast examination. So all you gotta do is you can do it when you shower, you can do it when you're bored, you can do it before you sleep, just raise up one hand, just raise up one arm, and then start palpating your boobs. You can do it circular, you can do it inwards or outwards, or you can do it vertically. This is very important because, especially for women who are already in reproductive age, or have hit puberty, because you want to be able to detect tumors or masses in your breasts. Okay, because as soon as if you feel a mass on your breast, please see a doctor. Okay, please see a doctor if you feel a mass on your breast. Okay, I had a lot of patients who have felt a mass or a tumor on their breast, and they don't go to a doctor right away, and they only go to the doctor like a year or two later when it's much too late. You know, please see a doctor. What do we look for in life? Yes, any mass. I mean, if you feel yourself now, like, even if you guys are all men, if you feel your breast right now, normally for a guy it would be flat, right? You won't feel, it would be smooth, you won't feel a lump. If you feel a lump, then you gotta start worrying. Get checked. Especially men. If you feel a lump on your breast, get it checked, okay? It doesn't, whether you're man or woman, if there's a lump there, get it checked as soon as you can. Okay? Breast cancer is scary. Yes, it is. It is, and I will show you why later. Okay. Alright, diseases of the breast. Okay. Diseases. Alright, first one is mastitis. This one is usually in females, okay? I haven't encountered a man with this, but this is usually women. So, mastitis is inflammation of the breast. Usually this happens in women who are breastfeeding. Okay? Because baby would suck on the breast for milk, and if they do it too long, sometimes the breast gets irritated, and you get inflammation of the lobules or any tissue underneath the breast. It causes redness and pain. Sometimes it could get worse from that. It could produce pus, and you would have pus coming out of the nipple or anywhere, So yeah. This is usually with the women who have this usually have a redness of the breast like this. It would be very painful. It would be slightly enlarged because of the pus formation inside. So the treatment for that is antibiotics. Okay, but if it doesn't resolve with antibiotics itself, you're gonna need a surgery, which is the surgery we do here is called a mastotomy, or incision and drainage, where you pretty much inside make an incision on the area of the breast that is most fluctuant, and then you gotta drain all the pus in there. Okay, you gotta drain all the pus. It's nasty, okay? It's nasty, and depending on the kind of bacteria that caused the infection, it could smell bad also. Okay. Next, breast mass. So there are two kinds of breast masses. We got the benign breast masses, which means tumors that are not cancers, or not cancer, basically. So, St. John, thank you for the sub. So here on this image that I stole from the internet, we got two kinds of breast masses here. We have fibrocystic changes, which is the most common benign breast condition of the... most benign condition of the breast. Usually this happens, this is normal. Like, for example, for some women, if they palpate their breast, they would feel like, I feel like there's like small masses or small, parang may mga maliliit na bukol sa breast ko. And it would be painful when they feel it. But actually, it's a normal fibrocystic changes are actually normal. It usually happens during certain times of their menstrual cycle. It comes and it goes. Usually there's like fibrocystic, that means there's like fluid inside the masses. They get big and then they just shrink after a while. So this ones you don't really need to do anything about it, just pain management. Okay. Fibroadenoma is a solid tumor. So like this, look at this happy solid tumor over here. So if it's a benign, if you feel your breast and you feel a solid tumor, it can be a fibroadenoma. So it's usually painless, it's round, smooth. You can do what do we do here? If you feel it, we usually do a core needle biopsy first. And core needle biopsy is to test what kind of tumor it is. It'll tell you if it's benign or malignant. If it's benign, you can advise the patient to have an excision biopsy where you remove the entire tumor. Other than that, there's also, before the biopsy, by the way, we also request for imaging like ultrasound or a mammogram. If the patient is still young, we just settle with an ultrasound. But if they're like older, like 40 and above, then we have to request for a mammogram. Okay. Next. Malignant. The next type of tumor is malignant or malignancy, which is cancer. Okay. These are the cancerous tumors. And there are different stages. The stages I will show you in more detail later when I open up ShareCare YOU. It is a lot more it is much easier to explain there than here. Alright, let me see this. Do women have to get regular mammograms? Only when they're 40 and above, like yearly, 40 and above. Okay. Because breast cancer is like one of the most common cancers in women. Okay. I will describe the stages later. So, what is the treatment? Here we go. One of the treatments before is a fine needle aspiration biopsy where you use a syringe and a small needle. But they don't really recommend this anymore. The gold standard is core needle biopsy, where you find the tumor. You can use an ultrasound to find the tumor if it's too deep, and then you use a large needle gun. This is a needle gun. It uses a gauge 14 needle, which is very big, by the way. Very big needle. And it pierces the boob into the tumor. And you imagine that they do this. They pierce your boob like 6 times or more to get good samples of the tumor. This is done under local anesthesia. Okay. Sometimes it's painful for the patient because it's a very big needle. Yes, a needle gun. The other method of biopsy is in excision biopsy, where you just literally just cut the breast open and just remove the tumor whole. Okay, you do this for benign tumors. It's a different story when it's cancer. Yes, gauge 14. Yes, 6 times. Core needle biopsy. 6 times, sometimes 9. Personally, guys, I would do 9. I will pierce your breast 9 times. I personally do 9. Just to be sure, I want to be able to get enough samples. Okay. So for cancer, you don't just do an excision biopsy. It doesn't end there. there is a procedure which is called a modified radical mastectomy, or basically what they do here is remove the entire breast, including the lymph nodes in the axilla. So see this, where the shaded area is the part of the breast that is removed. Okay, mastectomy means removal of the breast. It's just a radical or modified radical because you remove more than just the breast. You also remove the lymph nodes. But then there's also another, the other option aside from a modified radical mastectomy is, oh, I didn't put it here. Oh yeah, I didn't put it. The other one, if the tumor is a lower stage or a early stage cancer, you can do a breast conservation therapy, which consists of excision biopsy, where you just incise the breast and remove the tumor, and then you do a what we call a sentinel lymph node biopsy, which is wherein you inject a certain dye. Some of them use methylene blue. Other hospitals, they have a certain chemical that they they inject into the area of the tumor on the breast, and then they massage it, and they use a certain probe to detect which lymph node is reacting the most to it. So if you use a dye, the first lymph node that you see that takes the color of the dye, that would be the sentinel lymph node. And then you just take those around, I think if I remember correctly, you just need to take around 4 of those, and then you send it to a frozen section biopsy, which is a biopsy that happens during the surgery itself. And if there are no tumor cells within the lymph node, if there are no tumor cells or malignant cells found in that lymph node, then you don't need to do anything else. You can just close it up and you're done. So you basically conserve the breast. You don't remove the breast, you don't remove much of the lymph nodes. Now, if it's positive for tumor, you're gonna have to remove the lymph nodes in the axilla. And then after that, you do a radiation therapy. That's basically breast conservation therapy. Breast conservation because that entire procedure, which consists of 3 parts, you conserve the breast. You leave the breast there. Alright. What about screening tests like mammogram? Yeah, you do a mammogram every year for 40-year-old females. Doc Shiori, kadalasan ba kapag malaki breast sumasakit yung lukon? It depends on the woman. Personally, I don't really have back problems. I think it depends on the build of the woman. Because if you have a small build and you're not really that, if you have a small build and you have big breasts, then yeah, you would have back problems because the breasts would be heavy for you. But if you don't really have if you don't have the really small build, I think that's the advantage of those women who have broad shoulders or wider backs. They are able to carry the breasts more easily than those who don't have wider backs. So I guess that's one thing. Because personally, I don't really have back problems. I can stand up straight just fine. I think I have a strong back. I have a muscular back. Yeah, I was athletic before. Alright, so after you remove the breast, this is what it looks like. So the reason why breast conservation therapy was breast conservation is like a recent treatment. Before, you just remove the breast for cancer, but now they have breast conservation therapy to conserve the breast. Because, for women especially, having breast cancer and having your breast removed and having your chest look like this, it has a psychological effect on a lot of women to have their chest mutilated like this. That's why they've come up with stuff like breast conservation therapy or what do you call this? Skin sparing mastectomies and all that. Sometimes, if you have to undergo a modified radical mastectomy, they would include also a breast augmentation or ano to? They would also refer to plastic surgeons, so they can put a silicone to you know, so that it would look like you still have a breast here. Okay. Alright. Next. After getting surgery for the breast, of course, there's also chemotherapy. I always tell my patients that, you know, when you have cancer, it doesn't stop at surgery. There's always the chemotherapy, the medical part, which is chemotherapy or radiation therapy, depending on the cancer you have. Okay. Alright. Herbal medications. I get this a lot. I have a lot of patients like this. You know, they feel a lump on their breasts. They feel a lump and they get scared to go to a doctor, and they go to an arbolario. They punta sa arbolario, and then they get herbal medications. They don't see a doctor. They see a doctor once their breast cancer gets a lot worse. Usually they show up in the emergency room as a stage 4 case already. So, no, do not rely on herbal medication. I mean, you can take herbal medication, but you have to have, you know, scientifically proven medication. You have to consult your doctor and take whatever they prescribe you. You can use herbal medications as like supplements. Okay, supplements. But not as a lone treatment for your disease. I've had so many patients who've they know they have a lump on their breast, but they don't check up because they're scared. They go to the arbolario, or they go to that one doctor that is suing Doc Adam. They go to that one doctor that's suing Dr. Adam, if you guys know her. And they get all these herbal treatments, and then later on they show up in the ER as stage 4. And yes, I have gotten a patient who's seen that one doctor. That one doctor lady. I've had a patient, oh my god, it was terrible. It was terrible. The brilliant doctor. Yeah, the brilliant doctor. I think she called herself the most experienced doctor in the Philippines. Bruh. Boston C. Yeah. God. I've had a patient who went there. Oh my god, it was bad when they came to me in the ER, and I took their history and physical examination. I would ask them, "Ba't di kayo? Why didn't you guys see a doctor?" They said they did. They went to they went to her, and I'm like, oh, okay. Alright. Thanks. Oh, here, aesthetic surgery. So, breast augmentation. For those who want bigger boobs. Bigger boobs. I actually had a stream about this before. I remember streaming about this. I don't remember if it's on, it's not on my YouTube, but I did stream about this. I did stream about this once, and I know there's a clip on YouTube somewhere. Someone clipped that portion of my stream where I did or not really clip, made a highlight of that. You guys can just search for it. You guys can search for it. Breast augmentation. So basically, you just put the implant underneath the breast to make the breast larger. Okay. Breast reduction for those who have big boobies and want to have them smaller or reduced. Then there's also breast reduction, where you just take a wedge of extra skin and breast tissue and then you just suture them together. I'm not a plastic surgeon, so I have not seen this actually done. I have not seen this done because majority of Filipino women have small boobs. Very few are gifted like me. And personally, I don't want a breast reduction. Usually the ones who go for breast reductions are the ones who feel like their breasts are too heavy and their backs start hurting. So they go for breast reduction. Personally, I don't think I want one. I don't think I need one because I don't really have back pain. So yeah. Okay. Next. Oh yeah, that was the last slide. Last slide, guys. Okay. Boobies. Alright. Okay, we're going to... Let's see. I need to... I'm gonna open up ShareCare YOU. Oops, hold on. Let's fix that. Hold on, guys. Hold on, guys. I'm gonna fix the ShareCare YOU right now because that's what we're gonna look at. Teka lang, guys, ah. Okay. Alright, I'm going to... Let me just... Okay, there we go. Alright, ShareCare YOU. Hold on. Oops. I'm gonna close my PowerPoint and I'm gonna open up ShareCare. Oh, where is it? Share... Bruh. By the way, if you have any questions, you can ask me now while I'm opening up ShareCare YOU. Wag mo muna alisin. Bruh. Okay, we're gonna open up ShareCare YOU. There we go. No more boobs. Nope. No more boobs. Alright. Tama. Okay, I'm gonna... Is there sound on this? Okay. Alright! Boobies! What is this? This is a lady. This is a woman. I don't have the pro version of ShareCare YOU, so I can't use the other tools here. I want to get the... Alright, let's see. If I remember correct... Organs. Whoa! Okay. How common is breast asymmetry? It's very common. Okay, here we go. We have separated the boobs from her body, and it would be these. Oh, what? How do I select it? Bruh, I'm making her boobs disappear. What? I think it's system. I think we should go for system. Aha! I'm making her boobs disappear. Wait, how do I think it's in home. Ayun! Okay, there we go. Breast! There we go. Okay. Let's go to healthy boobs.
Sits on the superior anterior top front side of the chest wall in both males and females. In females, the breast...
Okay, let's stop. No, she doesn't need to talk. I already said all of that. Okay, guys, here is the boob. This is what you got. We're looking at the boobs up close and personal, alright? Up close and personal. And here is how the boobs look like when you take the skin off. Okay? Here is how boobs look like when you remove the skin. Okay? Now, let's see. Ooh. Oh, there. Oh, wait, what? Oh. Oh, hey. Oh, okay, here we go. This is... Oh. There we go. Okay. I have removed the skin of the boob. I have removed the skin of the boob. The nipple is fat. No, it's not. Look, you can see the ducts there. Okay, we're gonna zoom in. We're going up close and personal to the boobs. Okay, to the breast. Okay? Here we go. You can see the ducts here. Doc, ma-flag tayo. I looked up the toss of YouTube, and if the stream is educational, they won't. It's fine. I can appeal for it if they remove it. Okay. I think. How do you remove the fat? Okay, there we go. Ooh. Alright, if you remove the fat, this is how it will look like. Okay. This is how it will look like if you remove the fat. Now we are going to go here. You can see the lymph nodes of the axilla here. Now if we look at the ducts and lobules, here we go. See? Ducts and lobules. Okay. So here are the ducts of the boobs. How do I... Okay, there we go. I'm gonna look side view. Okay, look! You can see the ducts on the tip of the nipple. And then it is connected to the lobules of the breast. Okay. Lobules of the breast. And, no, lobes of the breast, which is made out of little lobules. Yes, this is educational. I do medical education streams all the time. Now, if we remove the... Wait, if we go look at the lymphatics, okay, there. This, the green stuff, are the lymphatics. So, lymphatics, lymph nodes here, lymph nodes. See, this is the axilla, or the kilikili, or the armpit, here in this area. So when you do a mastectomy, or when you do a modified radical mastectomy or an MRM, you have to remove also the lymph nodes here. Okay. And then circulation. Circulation is the blood supply. So there we go. Blood. Okay. Back to the lobules. I think we have some questions here. What are those sacs closer to the apex of the nipple? Oh, that's part of the ducts. Basically they pump the whatever is produced, the milk that's produced, they just pump it out. Okay. What are those sacs closer to the... Yeah, that's the ducts and the part of the ducts. The lobules are part of the lobes. So this is a lobe. This is a lobe and then lobules. Okay. Look at this. This is a lobe. Lobe. And then lobules are these ones. Okay. Even lymph nodes get removed with a mastectomy. Yes, with a modified radical mastectomy. If we go to the nitty-gritty of things, you have to remove lymph nodes from underneath the pectoralis. You have to remove this one. Sometimes there are lymph nodes that enlarge over here, but we can't see it. Oh, there. There it is. There it is. This one. Up here. On the top, there's a lot of lymph nodes over there. Though those are really hard to get, by the way. If you have really advanced stage cancer and the tumor goes to these lymph nodes on the top, it's very hard to get because look, they are very close to very large blood vessels. So those are the really hard ones, and usually you really need neoadjuvant. You need chemotherapy first before you do a surgery. Okay, I think there is also a... Ooh, this is like... Oh! There is also... Oh, here, like a sliced version. If you have a part of your breast sliced, this is how it looks like. So, we'll go to... Oh, there. See, this is how your breast look like when you have a pizza slice of it. So, let's look at the lobules. Look at the lobules when they are sliced in half. How do you make this? There we go. There we go. Look at that. Okay. I think, lymphatics, not much. Alright. Okay, alright, next, we're gonna go to breast cancer. Okay. This is a I think, oh, here we go. Alright, this is a normal breast. On the left, here on the right side, well, on the patient's right side, the woman's right side, and then this one would be the breast with the tumor. Oh, look, see, I can even put a stage here, guys. I can put a stage. Alright, we'll go for a stage 1. Second, thank you for the sub. Okay. So, oh, whoa, hey, whoa, I didn't know you can do this. I'm just discovering this now. Woohoo! Yo, I can put the tumor in anywhere I want. I can put her cancer here. Let's put her cancer there. This is so cool. Bruh. This is so cool. Okay, we're gonna... What is this? Oh, look, I can put more tumors. Look, I can put different tumors. Can I put many tumors on her boob? I can give her many tumors. Oh my god, I'm giving her more cancer. Can I see? Oh, there we go. Alright. I gave her lots of tumors. Okay. Alright, though this one is, we're gonna do the sliced, okay? Look at this. So we have a stage 1 cancer. Stage 1A, which is a T1. A T1 is a tumor that measures up to 2 centimeters. Okay? 2 centimeters. N0 means no lymph nodes. Metastasis 0 means there's no metastasis to other organs. So this is stage 1. So if you look at the interior of that, you can barely see. You can barely see the tumor because it's small. Here we go. Can't even see it. Okay. You will see it more there. Ducts and lobules. Where did I put the tumor? Look at the tumor! It is gross. See that? This is the tumor. Tumor 1. There's another tumor here. Tumor there. I think you'll be able to see it more. There we go. There's one also there. Okay? Cancer. This poor patient has 4 different tumors on her breast. Unfortunately, she cannot have breast conservation therapy. She's gonna need to have her whole breast removed for this. Oh man. God. Alright. Okay. Oh man. Okay, so what if we give her some lymph nodes? This is a map of the lymph nodes. So let's give her some lymph nodes here. Here. Let's give her lymph nodes there. Probably put some over here. These are the common places where the lymph nodes are found anyway. And over here, we'll put some here. There we go. Okay? And that would be a stage N3A, which makes the entire stage of this breast a stage 3C. So we went from stage 1A to stage 3C, guys. Alright? I just gave her some nasty lymph nodes. Ano to? Nasty lymph nodes. There we go. Look at that. We got. Oh my god. Okay, I just heard a cat just growl outside my window. Alright. So here. We have lymph node, tumor metastasis to these lymph nodes here. Over here. Lymph nodes Kulani, yes. Here and here. And I believe I placed one over here also. See? Oh. There. See, there's also lymph nodes up here, like I said. If you have lymph nodes here, it's really hard to get. Okay? Alright. Now, we can also add metastasis, guys. Look. Okay, breast cancer metastasizes to different parts of the body. Most commonly the brain, the lungs, and the liver. Most common. Very rarely, and also the bone. Bone as well. So, we're gonna go, look, we're gonna give her metastasis there. Of course we won't see it. Of course we won't see it here because, you know, we don't really have the liver and stuff here yet. But yeah. Do the lymph nodes change color? Mostly in actual surgery, you just feel them. They're hard. They're like hard little marbles. Okay. Yes, bone. Of course, we don't see it here. Alright. Humphrey, thank you for the sub. Okay, now what if let's make the tumor bigger, guys, okay? What if we have a larger tumor? So, let's go for a, Let's go for a stage T4D. Okay, we're gonna go for T4D, guys. This is gruesome, actually. Usually I would see T4Ds over here. We're gonna have that. Okay. I'm gonna, how do I remove this? Can I remove this? Can I remove this? No, I can't. Reset, there we go. We're gonna give her a T4D. Okay, let's say she has one tumor. And she has a T4D, which makes her a stage 3. Okay. I will show you what a T4D looks like, okay? And why is there no tumor? Wait, what? Okay, we're gonna add another tumor. We're gonna add another tumor here. Let's add one more. We'll add this. We'll add it here. There. Okay. That's better. Alright. Here's her tumor. Now, what is a T4D? We'll take out the metastasis. Okay. What is a T4D? T4, when you have a T4 tumor, it means there's invasion of tissues outside of the breast. It can be of any size. But there's invasion into the chest wall and the skin. Alright? Now, let's go here. It's not seen. Unless it's seen. Oh, what? Oh, there. Okay. Yeah. It's not as gruesome as I thought. But if you notice, if you compare the breast here is reddish, okay? If you compare it to this is normal. This is the normal side. There's like a reddish discoloration. So there's a skin invasion. But I've seen worse looking ones. If you have a T4D, they look really worse. Imagine having your tumor invading through your skin. It actually ruptures through the skin. So there's a tumor right there. I think, isn't there a way to like DCIS? Oh hey, I can put a DCIS also. That's pretty cool. What if... Oh, okay, here we go. What if I put a T... Let's put it here. I think this one will be it. I think that will be better. T4B. Yeah. I think that one would actually... Oh, there we go. Look at that, it's nasty. Is it seen? Oh no, it's not. Oh wait, it is. Oh no, it's not. It's not seen. They don't have the option to like have the cancer like coming out, erupting from the skin. I've actually seen those, and those are real. Yes, they have. There are cancers that actually reach the skin, and it really looks nasty. Like for example, you see this? You see this tumor right here? You see this shit right here? Imagine this poking out of your skin. It looks exactly like this. It looks exactly like this, but like eroding your skin. Okay? Literally erupting and eroding your skin. Yeah. That would be a stage 3, at least a stage 3B. Okay? Unfortunately, I can't. Apparently, there's no option for putting that. What if I put this here? What if I do it there? Because when I look at it, it doesn't really show up. Yeah. It doesn't really. Let's see. Oh, there, look. So you can see it here, but if you look the breast, it's not really seen. But you can see the tumor, like, coming out from the fat. Yeah, it's like making the skin decay, and it smells really bad. It can smell really bad. It has a smell. It has a terrible smell. Is it me or is the model of the tumor pulsating? It's you. It's not pulsating, man. They don't have, they're not alive. Well, they are alive, they're cells, but, you know, you get what I mean. Okay. Necrosis, yes. Can you explain the blood and nerve supply, please? I really want to recall. Blood supply. Okay, let's see. Is there a... Oh, okay. I think there is... Can you have labels? Oh, there's no labels? Alright, we'll go back to, let's go back to healthy breast. I think... oh, oops. Are there, bloods? Oh, they don't really... Oh, they don't mention the blood supply, huh? They actually don't... They don't describe the actual blood supply here. Alright, blood supply of the breast. So, there are 3 major blood supplies to the breast, by the way. But it's not labeled here, so I won't be able to graphically tell you. It's very tiny. If I will tell you... Hold on, I have to give you an image of it. Hold on, okay? Blood supply. It's better if there's an image so you guys can actually remember it. Let's see. Hold on. If I look at the breast from... oh god. It's even hard to look. It's hard to look at. It's hard to look at because the muscle is also red. It's hard to look at because the muscles are also red, bruh. Okay. Alright. Hold on. Is there an actual image that shows the major blood supply? Oh, here. I think this one. Okay, I think this one is a... Here we go. Save image as. Hold on, guys. I am going to give you. Alright, I will show you the vascular supply of the boobs. Hold on. Let me just get it here. Where is it? Where is it? Oh no, where is it? There it is. There we go. Alright. There's 3 major blood supplies of the breast, okay? I mean, three major blood supplies for the breast. So we have the internal thoracic artery, which is in the center, okay? This image shows the left breast. Oh no, not the left breast, the right breast, sorry. The right breast, the right of the patient. So the three major blood supplies are internal thoracic artery, the lateral thoracic, and the branches of the posterior intercostal arteries. Okay? Those are basically the ones that you need to know. The branches. The internal thoracic artery, lateral thoracic artery, and posterior intercostal branches. Okay? The lateral thoracic artery is a branch of this axillary artery. Okay? You can actually, so if you see axillary artery or branch of axillary artery, you can say that. Okay? Okay, let's see. How do I take this image off? There. Okay, next. Next question. Can the skin recover, or they don't have the option but to remove the skin? If you have a breast cancer that invades the skin, one option is to undergo chemotherapy first. We call it neoadjuvant chemotherapy. If you say neoadjuvant, that means chemotherapy or therapy before surgery. And if you say adjuvant chemotherapy or adjuvant therapy, it's the therapy after surgery. So, if we have breast cancers that are like stage 3, 3C, we usually advise neoadjuvant chemotherapy. Why? So that we can try to preserve the breast and try to make the tumor smaller. Because if the tumor is way too big, it's way too big, and let's say the patient is not a candidate for breast conservation therapy, you would have to do a mastectomy where you remove the entire breast. But see, if the tumor is too big and you remove the entire breast, you might not be able to close it, right? Because of the tumor being so big that you remove too much of the skin of the breast area that you cannot you won't be able to close the skin, close the wound. And when that happens, you have to refer to plastic surgery to put a skin graft over there. Yeah. So that's why we usually advocate for neoadjuvant therapy so that they can make the tumor smaller. It's also more complicated if this tumor here, it becomes more complicated if the tumor invades the muscle, like you see in this one. It's actually attached to the muscle here. You can see. Yeah. Okay. So, yeah. Any more questions? Ooh, we can go for a... Sounds expensive, yeah, the plastic surgery, skin grafting. It can be expensive, it depends. So there, and what else? What else can we see here? Let's see. 3A, 3B. Oh god, that is very big. Oh my god, imagine what if we actually... I want to see what happens if I make her breasts really bad. Like, let's like make all the lymph nodes positive, man. All her lymph nodes are positive. Let's give her all her lymph nodes. I feel bad for this if I do this. Oh my god, look at that. That is terrible. Bruh, I just gave her the worst N3C nodes. Oh god. God, look at that. So there's a chance you could get cancer of the muscles in this extreme example. Not really cancer of the muscles, but more like it just invades the muscle. It doesn't really turn into cancer of the muscle. It's still breast cancer. How does skin grafting work? Skin grafting is when you get a portion of the skin on the thigh, on the inner thigh, like a really thin sheet of skin from the inner thigh, and you just place it on top of the wound here on the wound, and then you have to staple it or suture it there, and then you have to leave it on for a few days. That's skin grafting basically. Okay, you're evil. Yeah, I gave her a stage N3C nodes. Well, right now she's a stage 0, but there is such a thing as look, we can give her DCIS, which is ductal carcinoma in situ. And how does that look like? Oh my god. Oh. So that's how ductal carcinoma in situ looks like. It looks nasty. Okay, this is a ductal carcinoma in situ, or DCIS, is a precancerous lesion. Okay, it's not cancer, but it's a precancerous lesion. If you have DCIS, you have a huge chance of developing cancer of the breast. Okay, especially ductal cancer. Look at this. It looks nasty. It looks like a dead tree branch. Also, it's not just any excess skin on the person. No, it's not. It's like not really. It's just getting this part of the skin, because the skin that you get on the thigh, it would heal up anyway. Yeah, it looks like dried branches, bruh. If we look at LCIS, let's give her LCIS. Oh my god. Okay, LCIS, and there you have like a nasty looking lobule here. LCIS is lobular carcinoma in situ. Okay. If I have a didactics on breast, yeah, I'm referring to you. To be honest, guys, I hate breast. I hate in my surgical field, I hate breast. I really don't like breast, to be honest. Breast sounds like it's very simple, but it's actually really, really complicated. Because if I get into the nitty-gritty of this, it gets really complicated. Especially the treatment for breast cancer. It depends on the stage. It depends on the stage what the treatment will be, and there's way more that I haven't mentioned yet. Like there's like hormonal therapy, and then aside from biopsy, they have breast panel, which includes like the estrogen and progesterone receptors, and receptors like HER2/neu. I hate those. I really hate breast, to be honest. It's complicated, yes. It's very complicated. Breast cancer is a disease or a cancer of the breast that really needs multidisciplinary approach. It's like it has to be handled by multiple doctors of different fields. So you got surgeon or the breast surgeon, you have the oncologist, you have the, sometimes plastic surgeon, because of if you need a plastic surgeon, it's really, sometimes you also need the OB/GYNecologist to be there, because sometimes breast cancer is related to cancers of the reproductive organs. Okay. I don't like breast. I really don't. It's very complicated, okay? It's like it's my least favorite least liked surgical procedure. Anything related to the breast, I really don't like. Yeah. The next one I don't like is actually the next organ I don't like, or more like another one I don't like is colon, or well, anus. I don't like the anus either. I don't like the anus. It's dirty work, man. Okay. So yeah, I guess that's all of Oh wait, before that we gotta go to we discussed female breasts. We gotta go for the man boobs now. We gotta go for the male. How do I go to male? Can I go to man? How do I change the character, the person? We gotta go to man now. Oh, here we go. Male. Okay, can we do breast on males? Oh my god, guys! You guys, men don't have boobs. I can't even go to man boobs. You guys don't have boobs. Bruh. Walang boobs ang lalaki. You guys don't have boobs. Oh man, so that means I can only go for female boobs. Female breast. Bruh. Let's appreciate boobs in anime. This program can simulation lactation of breast. Unfortunately, no, it cannot. Not yet, anyway. Alright, guys. Have you guys learned a lot? Let's see. Oh, this one has this one explains the hormones. Alright, guys. It's time for quiz. It is 10:30. Guys, it's time for quiz. Can you explain the male side? It's basically the same. Okay, for male breast, it's basically the same. The diseases are exactly the same as in females. I mean, the cancer is the same. But men cannot get lobular carcinoma in situ, or the LCIS, the one I showed you, because you guys don't have lobes, so you guys can get that, but you can get DCIS. Okay, you cannot get LCIS, but you can get DCIS. Right? Okay, guys, quiz. Ito. Test your knowledge in a quick 10-question quiz. Siguro naman kaya nyo to. Okay. Kaya quiz. Alright. Let's see. What's this? Oh, okay. Choose the label from the list that matches the dot. Hey guys, ang dali-dali lang nito. Ang dali-dali lang nito, guys. Oh, sagot. You guys have, let's see, areola, artery, duct, fat tissue, lobules, lymph node, lymph vessel, nipple. Oh, identify the structure. Napakadali lang naman to. You lost your BGM. Yeah, I turned off the BGM. You want it back? Oh, here, I'll give you the BGM back. There you go. You want the BGM back? Okay. Para hindi kayo, just so you guys won't get nervous during your quiz. Sagot! Okay, let's see. Omori says lymph node. Multiple choice na. Ang daming sagot dito. Duct, areola. Areola to. Mammary ducts. Quiz fail. The choices are right here, guys. It's very few. Okay. People say ducts. Okay, ducts. Alright. Tama. It is ducts. Good job. Okay, next. Oh, ano to? This one. Bruh, what is red? What is purple? This has gotta be easy, man. What is this? It's not even specific. I didn't... Andyan yung choices! Pick one! Pick one while I drink my water. Lymph vessel. Puro pala call grade review. Lymph vessel, artery. Okay, most of you are saying arteries. Okay. Wow, naging specific yung iba. Yeah, anyway, okay, artery. Most of you said artery. Okay, tama, artery! It's artery, it's red. Veins are usually darker, okay? Veins are darker. It's artery. Veins are the darker ones. Oh, this! What is this? Okay. What is this? Identify this structure. It's like one of your favorite parts of the breast. Identify. Lana bagsak na. Identify this part, guys. Areola. Wow, you guys have like basically the same answer. Alam nyo guys ha. Alam nyo talagang isa sa mga favorite parts nyo ng breast. Alam nyo yung sagot. Arenola tayo. Alright, it's areola, okay? Hayop kayo. Alam nyo ha. Oh, what's this one? Pucha. Oh my God. Tayo na, isa lang pwedeng sagot dyan. God, that is a very easy question. Alam mo, kung may nagkamali dito, kung may nagkamali dito sa next question na to, minus 10 points. Minus 10 yung may magkamali dito. Skin po. Skin tan line. Ang magkamali, minus 10. Okay. Skin. Balat. Skin. Bobs. Balata ng mali. Oh, 0 agad pag nagkamali kayo dito. Of course, 0 agad. This is a very easy question. Okay, so a lot of you answered skin. Yeah, whoa. Wow, tama sila, oh. Okay. Next, oh. Kung yung isa artery, ano to? What's this one? It's the darker one. Doc Shiori, pag perfect score namin, pwede ang reward makita. Tiyan natin. I will give reward sa mga perfect. Napakadali naman itong. This is a very easy quiz. Okay, may sumagot na arteries. Kakasabi ko lang kung isa artery, ano to? Vein, ugat, vein. Maugat. Artery pero tan. Bra. Okay, veins. Oh ha, tama kayo ha. Wow, 5 out of 10. Alright, next. Oh yan! What's this? What is this green bean? Ito, beans. Identify this part. Identify. Okay, let's see the answer. Okay, someone says lobules. Lymph node, mungo. lymph node, mungo, lymph nodes. The node thing, not true. Wala na, 0 agad. Alright, majority answered lymph node. Okay. Lymph node. Yeah, wow, 6/10. Okay, next. Kung may lymph node, ano yung isa? What is this one now? What's this one now, guys? Just pick the choices from here, okay? The choices are on the side. Open notes na nga eh, oh. Imagine kung hindi ko in-open notes, guys. Paano kung ganyan, oh? Pwede kong i-close notes yung quiz, ha? Open notes yung quiz. Okay. Lymph vessel, ugat ni lymph node. Lymph vessel. Okay, lymph vessel. Okay, a majority said. Almost everybody said lymph vessel. Okay. Pero 7 out of 10. Wow. 7 out of 10 na kayo, ha? Alright, next. O yan! Identify this. Isa pang favorite part nyo ng boobies. Obviously, favorite part. Teka, close notes yan. Close notes. Close notes. Walang kodigo dito. Identify. Wrong spelling, wrong ha. Pag ito, nagkamali kayo, tapos wrong spelling, wrong. Wrong spelling, minus 10 points. Okay, we got our first wrong spelling. Si Nepal, sabi ni Ash, minus 10 points ka na. DJ Suryong, Napoleon, okay, wrong. Minus 10 points. Lazy Coffee, Nepal, minus 10 points. Ang daming minus 10 na. Okay. Nepal, si Ventix, minus 10. Warlord, minus 10. Nepal. Okay. Ang daming mali spelling. Nuem. Nipol. Wrong spelling, wrong. Wala na. Ang daming bagsak, ah. Ang daming bagsak dito, ah. Naples. Oh, si Clay. Wrong spelling. Okay. Skyler. Lymph node. Tayo na! Lymph node. Okay, Nips. Hello, class. O, tayo na tong si Silos. Silos, late ka naman. Ongoing na nga yung quiz, eh. Hayop ka, Silos. Bagsak nga yung iba, wrong spelling nga, hindi nila mas-spell ang nipo. Silos, 0 ka na. Silos, hindi, late ka, 0 ka na. 0 ka na, Silos. Itong mga to, hindi marunong mag-spelling ng nipple. Mala, minus 10 kayong lahat. Minus 10 kayong lahat. Okay, wala na. Next, ano to? Mas mahirap to. Okay, this is a little hard, bruh. Ang hirap nito, ah. This one can be okay. Identify that one. Teka, gawin ka natin. Let's zoom in. Oh, yeah, there we go. Identify. Okay lang. I am Thai people. So, Tanupa. I'm sorry. I said that for the previous question, they got a They gotta answer. They gotta identify the structure, and I closed the tab so that you can't see. Because if you get the wrong answer, I would give them minus 10 points, and minus 10 points if they spelled it wrong. So they all spelled nipple wrong. So they all get minus 10 points. Basically, no one passes the quiz. Lobule. Okay, everyone says lobule. Lobule, wow. You guys could have gotten at least a 9 over 10 if you guys didn't spell nipple wrong. Okay, what's that? Identify this, guys. Identify. What's this one? Dali lang, oh. This is very easy. Oh, open notes now. It's open notes. If you get this right, you could have gotten a perfect score. You could have gotten a perfect score, but you guys got a minus 10 for spelling nipple wrong. Hopes and dreams. Fat tissues, adipose, fat. Okay, most of you say fat. Look, see? 10 over 10! But then you all spelled nipple wrong. So you guys get a 0. The actual score is 0 because you guys spelled nipple wrong. Okay? Nasa kantin tumakas sa hato. You guys did. Tayo. Worth? 0 kayong lahat. You all got 0. You all got 0 except for Tanupat. Why doesn't wait? What is it? Why is it show suspect? Yeah, it doesn't. Like the program isn't really perfect. It's incomplete actually. Because even if I look at the other organs, it's not as complete. So I think the developers might improve it more. Hopefully. Daya. I spelled nipple. Hi DJ, you did not spell nipple correctly. Excuse me. Bonus, walang bonus. No bonus. No bonus. No bonus, you all failed. You all failed except like maybe 1 or 2 people. This program needs more anatomy label. It does. It does. But it's pretty good. It's pretty good though. I mean, it's actually pretty comprehensive on its own, but it can use some work, especially when I did colon last time. It lacked entries on cancer. It would have been cool if there was cancer. So heart. So maybe next time if I do this, I can probably do heart next, but I'm not really that Oh wow, the heart is very comprehensive though. Look at this. Heart is very comprehensive. This is interesting. Wow. Okay. Eye. I don't know much about eye, so I can't an ear. Bladder. Overactive bladder. Oh, this one is lacking. Brain. They don't have much. Liver. Not much either. Kidney. Yeah, there's not much for the others. Spinal cord. Oh, reproductive system. Virus. Bro, stomach, exterior and interior, and then virus. By the way, we can explore the virus, guys. I think Atlas Pro will give more detail, but I don't know which one is better. We'll see. But I think ShareCare YOU, they can just continue developing it more, and they could add more stuff to the program. That would be really cool. Retake ng quiz. Walang retake. No retaking quiz. My bias sa heart and nerves. Probably, maybe it's like cardiac. They don't have gallbladder unless this one includes gallbladder. Let's see.
Located below.
Oh, pancreas includes the gallbladder. Oh, look at that. Gallbladder. Abdo. Okay, let's go back to the chat. Oh my god, I forgot to remove the bits and subs up here. Wait. There we go. Alright. Yeah, we're done with that, guys. Help again. I would like to, if you guys want me to improve on medical education streams using ShareCare YOU, the program a while ago, it will help a lot if I had the pro version, because I could like draw straight on it. I can draw on it and make. I can actually make videos using that program. But I need the pro version, which is like $100 more. That's why I have a dono goal up there for the ShareCare YOU to get the pro version. Blood cells next time. Blood cells! I don't know, not really, because that's not really surgical. I'm a surgeon, so I focus more on surgery stuff for my medical education streams. I'm still the first guy who $2, yeah, basically. Remedial and no remedials. Cholecystectomy next. I think I did gallbladder before. Did I do gallbladder? I don't remember. I'll check my I will check my did I do gallbladder? I think I did gallbladder before. I remember making a medical education stream about the gallbladder, but I don't remember if it was on Facebook or on wait, let me check. Okay, gallbladder. Gallbladder. Oh yeah, I did. I have gallbladder. I forgot. I did gallbladder already. It was with Sir Wheatbread. Sir Wheatbread had his gallbladder removed before, and he was a guest on that stream. He underwent gallbladder surgery, and I actually showed his actual gallbladder. Brain is more specialized. I can probably do brain, but I can only discuss very little about it. Like, nothing too comprehensive, because I don't really... Brain is not my subspecialty. Bones, that's orthopedic surgery. I can probably do a little bit about bones, but not so much because I don't really handle skeletal system. So yeah. Do you already have medical education about the brain functions regarding senior citizens? I need a bit of idea because they annoy me a lot. Brain, you know, like dementia and all that. I can probably do brain, but more in relation to neurosurgery, which didn't I do? I don't remember if I talked about that. Didn't I do neurosurgery already? Hold on. Oh no, I did seizures. Okay, I did seizures. That was the one thing about brain I did, seizures. I remember I covered seizures because of a recent issue. I mean, an issue related, like, there was someone who had a seizure in front of a convention, and then there was, like, an issue on Facebook about it. Yeah, I did seizure. I can probably do, brain. I'll probably focus more on, if it's brain, I will focus more on bleeding and, tumors, maybe. Are you a general surgeon or expert? I am a general surgeon. What is the worst surgical case you've ever encountered? Worst, like they died, or worst, like it was complicated, or maybe the worst one. It's usually trauma cases. Like, I had this one patient years ago who got shot, like, point blank on his side. It went through and through his abdomen, like, from one side to the other, and passed through his liver. The guy died because it was really bleeding bad. He survived the surgery, but as soon as he got transferred into the ICU, he arrested. It was really bad. That was one. If you stream game next time, I recommend you play Project Hospital. Project Hospital? Oh. Yeah, Project Hospital. I'll look that up. We'll educate about how the hospital... Oh, isn't this like 2 Point Hospital? Or is this different from 2 Point Hospital? Yeah, trauma cases are really hard. Okay, I will look up Project Hospital. But, you know, yeah, I've been looking around for more programs and games that are like surgery or medically related, and so far there isn't much. Hopefully there will be more, because it would help a lot, you know? So yeah. Anyway, it is almost 11. We're good for now. I will be ending my stream. I'd like you guys to I would like to thank you guys. Thank you everyone for watching my medical education stream. I hope you guys learned a lot. If you guys still want to watch me, I stream for those who just wait for me on YouTube, because every time I stream on YouTube, like every month, there's always some people who say like they don't see me much, or like I should stream more, something like that. I want you guys to know I only stream on YouTube once a month. I do post videos if I can, when I can, if I have time. Like, I think my last video was like weeks ago. I like highlights or clips. I stream I regularly stream, or my main platform is actually on Twitch. I play a variety of games. So, yes, I am a gamer doctor. I play a variety of games on Twitch, and I use YouTube for video uploads, clips, highlights, and for my medical education streams. I used to do medical education streams on Twitch, and then I would just upload the VODs here on YouTube. But I've decided to switch from into doing the medical education streams here on YouTube. So I don't have to keep, I don't have to like download the VOD from Twitch and then just re-upload on YouTube. I decided to just do it here, so it's uploaded straight to the platform. Yeah. I will give more donate for the apps. Thank you. Yeah. If you guys want to donate just to help get me the ShareCare YOU Pro version, yeah, you can donate on my gank. Okay, my gank now profile. The link is on the description below. Okay, use the gank. Okay, don't use coffee. Use gank. I usually use the coffee for like ano to? I use it for donations if I need it for patients, not the gank. The gank is like directly to me. You can export from I know you can export from Twitch to YouTube, but I'd rather just stream directly on YouTube, the medical education streams. I think it's better that way. Like it's a way to segregate my content. It's like direct, you don't have to download the whole VOD. Well, the reason I download the whole VOD is because I also want to keep the VOD. I also want to keep the VOD for myself. Alright. Have you played Trauma Center? Yes, I have! I would love to stream Trauma Center. It's just that I can't unless there is a way to stream that without using... I don't want to use the emulator, okay? I want to use an official, legit game system. Because I don't want to use an emulator because, especially when I stream on Twitch, I don't think it's ethical for me to use an emulator. I don't want to use an emulator, guys. But yeah, I would love to stream Trauma Center. If I can. I would. Because that's a really good game to stream. Alright, so yeah. We're good tonight. Thank you everyone for coming to my stream. And I'll see you guys next week, because for the rest of the week I am busy. For the rest of the week. I have my relatives who came from abroad. They went to the province. They're coming back here to the house, so I can't predict when I will stream this week. I might be able to stream sometime this week, but it'll be like a guerrilla stream maybe. So I can't really. That's why my stream schedule is just two streams, and then the rest is nothing. Yeah. Okay. Thank you, everyone. I was about to say let's go raid someone, but I forgot I can't raid. I don't even know how to use the raid feature on YouTube yet, so I'm just gonna end stream. Good night, everybody. Otsupon, thank you so much. Thank you, Otsupon. Bye-bye.